Peace, everyone. Welcome back to Ummi Talks, where this is not a show, it's a conversation where we discuss all things pregnancy, postpartum, and parenthood. Today, I'm here with my lovely Ummi herself, Queen Mother. Mommy, would you like to introduce yourself?
Hi everyone. Assalamu alaikum. I'm Sister Renee Muhammad, mommy to Nafisa and her 5 siblings. I've been a registered member of the Nation of Islam since 1992. And I'm here to oblige my daughter with this interview.
Thank you. I appreciate it. So let's see. Where do I start with you? Because you're a mom of 5 biologically and some bonus children. So I usually start with just asking you like about your journey with motherhood, but let's start with pregnancy. So I guess we'll start with your first child. What was that pregnancy like, if you can remember, or any of them? What was the pregnancy like? Or you can start with me. Your pregnancy with me, because I think we talked about that a couple times.
Okay. Well, my pregnancy with you was actually was the most difficult. As far as carrying, I gained the most weight with you, although you were the smallest, and it was very trying. That pregnancy, but you know, I had cesarean section with all my children, so it was no different, you know, birth-wise, the cesarean section, and that's always uncomfortable, the aftermath of it all. But that's one thing I remember, that I gained the most weight. I was swollen, my feet were swollen, my ankles were swollen, I was really puffy in my face, and I expected you to be so much bigger, but you were a tiny baby.
So, what was maybe like the most challenging aspect of pregnancy for you? Was any of them?
It's hard to say. I was always on the move. I worked right up until the last minute. I think with each pregnancy, except the last with the boys, with the twins. So I just was always on the move, and I guess just trying to, you know, tug the weight along, because I always needed to, you know, retain income. So I think that was it. I do recall, however, also with you, the nausea was the worst than any other pregnancy. That year we traveled to Ghana for Savior's Day. And I was so miserable. That was miserable. But all praises due to Allah and His mercy. When we finally did arrive in Ghana, I stayed at one of the little village resorts. Not resort. We had an option of going to a resort. I've told you this before, or going to like the little village hotel, which was less expensive. So of course that was the package I had, and thank Allah, the cook there, a local guy who cooked fresh fish from the ocean, his food was the only thing that settled my stomach. So praise be to Allah. Every evening I look forward to dinner because my stomach was settled. I can keep it down. It was nourishing. It tasted good. So that was the first time I had fish with the head still on it.
Okay, all right. So what about because you've also experienced loss. I know that a lot of moms who like listen and tune in have experienced loss as well during pregnancy. Do you care to share a little bit about that at all?
Like what specifically would you like to know?
Well, just your journey with loss during pregnancy. And what helped you to kind of get through it?
That was a little rough, because it was other things going on as well. So really, if I had to say anything, it was the grace of God and time. Because, you know, as long as you're not in total despair, time kind of helps you heal, and you eventually just, for me, eventually I was just, you know, just grateful for the small, short experience I had with the pregnancy, and you know, just moving on.
Was there anyone who like you talked to during that time to like kind of help you or just vent to or
Unfortunately, no. Wasn't really
much support?
no, no. And not that there probably would not have been had I reached out to anyone, but I can't recall anyone. Oh, mommy! I can't recall anyone in my circle at that time that I think I may have even felt comfortable with talking to about it. And you know me, and back then it was always, kind of, it wasn't, we weren't at least I was not accustomed to reaching out for help and trying to, it was always just kind of, I think thanks to my grandmother, just, move on.
So I kind of actually want to touch on that a little bit. Why do you, I mean, I guess you kind of just answered it. Your grandmother was that way, but I know that's something else that women struggle with, where they feel like they just got to figure it all out by themselves, or they just do everything like on their own. What maybe advice would you give to somebody who might be in a state of loss or just pregnancy and feeling alone and isn't necessarily reaching out for help?
That, with loss and with anything else that maybe, just causing anyone any type of grief or discomfort even, that do what you need to do. That's what I would say. That if you need to reach out to someone, do it. If you need to talk to someone constantly, do it. Do whatever it takes to get you back to your best self. That's what I would say. I would never I would never advise that anyone just kind of try and, especially if they need it, to try and get you anything on their own.
Mm-hmm. Now, you also shared that you had a C-section with all of us. What was that experience like?
That wasn't pleasant at all. My first one actually went okay, except that back in those days they didn't do what's called the bikini cut, straight across incision. No, as a matter of fact, they had just started it. My mother had the up and down, but so I had the bikini cut, which was great. And back then, you really had time to recuperate. We stayed in, I stayed in the hospital, I think, for 7 days. And they really looked after you. They looked after your wound. They made sure there was no infection. They made sure that even if there was the slightest fever, there was treatment, whatever. But by the time I had your brother, my second child, that had all changed. The insurance companies were like, no way, 3 days, get out. So I think it was with him or with you that I developed an infection, and they had to send a nurse's aide out, to treat it, and that was miserable because, with the that was just miserable. I don't even think people want to hear all of that.
Oh, they do.
Well, the incision kept becoming infected, so it was a pocket of pus. So the nurse's aide had to keep coming out, rupturing the pocket.
Oh my God.
Packing it with the it's like a certain specialized type of gauze. I forget what it's called. Pack it, soak it all out, clean it, all of that, and come back the next day. I don't know if it was every day, maybe every couple of days. I want to say it was every day though, and do it all over. Because just because you can't stay in the hospital long enough for an incision like that to, to heal properly. And with that pregnancy, I had tried a VBAC, which is vaginal birth after C-section. And, so it was, that whole area was just, spent. I was spent after that. Because I told you before, we tried for 23 hours to get the vaginal birth down. And then finally we got to do a C-section.
Sheesh. So what was, and we're going to look here now because that one died, but what advice, with all of your experience, right, do you have for someone who wants to be a mom?
Um, just be ready for it. My advice is always that once I've told you this and my nieces and anybody that I've had the pleasure of having that type of conversation with, that once the baby comes, it really is all about the baby. And not that you neglect yourself, but the baby is time consuming, as you know. Yes, she wants what she wants when she wants it. Right? Right? Right, Mama? And it's a lot. It's a lot to take care of a family, a husband and mama. To take care of a husband and a baby. And we've heard many words from our minister, from Mother Tanetta, from Minister Ava, about preparing for that. So I would say anyone who wants to become a mom, make sure you prepare physically, but especially spiritually and emotionally. Be ready, because you're nursing that baby in the womb, and then you're nursing the baby once he or she is born. So be prepared, especially spiritually.
Okay. What about we've talked about your journey with pregnancy and how it was a challenge, and you had C-sections with all 5 of us, which is insane. Because I've heard that the healing process takes a lot longer than if you had a baby vaginally. What about once, the babies came and you were a full-time mom, but you were also, okay, so let me say this. I remember growing up, you looking like you just had it all figured out. You was just doing X, Y, and Z. You was cooking every night. You were going to school. You were taking care of us. Laundry was always done. House was always, if not 100% clean, pretty decent. How did you manage to do all of that and make it look so easy?
First, I want to say that I don't know why it looked like I had it all figured out to you.
It did.
But, I don't know. You just do what you have to do, especially for me, when you have children, things just have to get done, and you do them. But it was not easy. It wasn't easy. And thank Allah, for a brief, period of time, I was able to not have to work. I went back to work periodically. And then when you all got a little older, I decided to complete my degree. And that's what I would say too. Do everything you want to do before the children come. If you can. That's just me. If I had to do everything over again, I would have done it all before the children came, had my career, and then be able to focus 100% on the family and children. Just when they come with me.
Now, what about the moms? Because I know a lot of moms who have children and they feel lost in motherhood. They feel like they've lost their sense of self. They are trying to figure out what their dreams are, what their passions are. They're trying to go back to school, go for their careers, because they just feel, again, lost. They almost like they're trying to discover their identity all over again, which I think does change after you have a baby. Your identity kind of changes a bit. So what advice do you have for those moms who are in that space?
And that's why I think it best that you do it, because once you have a baby, you become that child's mother, and that's it. And then you still have a husband and a home to take care of, and then whatever other if you're active in the community or in your mosque or wherever you worship, and then have family friends too. It's a lot. It is a lot. So but you are 24/7. You are mommy. When the baby eats, sleeps, falls, is sick, cranky, teething, developing a personality. So it can become that, especially if you haven't done the things that you wanted to do first. It can become very isolating. It can become very become very overwhelming. And something I also told you, the sisterhood is
Where
absolutely
did this even come from, girl?
out of my purse.
Oh.
The sisterhood is absolutely indispensable at that time period because, you know, a long time ago we raised children as a village, not individually with just our, you know, our singular families. So when you have a sisterhood behind you that can come over one day and, you know, even if sisters got together and took turns keeping children while they just took a walk in the park or whatever the case may be, a doctor's appointment, whatever. You know, the reason why we were able to homeschool is because of our sisterhood in the study group. You know, we were able to get together and figure out who would do what and figure out who would do what. Oh, no, we're not having it. Stop. We're not having it.
So is that essentially the advice then? Like, of course, obviously, ideally, try to do everything beforehand. But if you can't and or haven't, and you're now in that space, lean in on your sisterhood. Try to connect with other sisters who can help support you.
Yes.
During those times.
And your sisterhood, your family, whoever can support you. Try not to get isolated, you know, because that to me, and I've seen it, you know, with some young sisters I've spoken with, it's easy to get isolated, and then it gets worse. To me, you know, it appears that it gets worse once you're isolated and you know, trying to figure out everything on your own. So yes, I would the sisterhood is just it could be everything during that time period.
Absolutely. Now you have, let me see, between me and my oldest brother, there's what, like almost, Jesus, girl. Between me and my oldest brother, there's almost like a 15-year gap or so. What changed in your style of parenting from him to me?
Well, because with each child you grow. You know, parents grow, and you also realize that each child is different, right? So a lot of things change, but definitely I was a lot more strict with my oldest son. You know, he complains about it, and it was I don't think I valued parenthood as much then, and I was a young mother, so I made all kinds of mistakes. So a lot changed over those years, a lot. I think fundamentally everything was the same, you know, beliefs and core values and everything, but it was more of, I was a single parent, so I was more providing, you know, I was in the provider mode too, so it was work.
And you worked like 3 jobs.
When I was pregnant with your brother, with the second child, with Rodell. Yeah, I had 3 jobs then, but it was work. But you know, over the years, especially because of the teachings, you know, I began to value parenthood more. So I valued the time with you, instilling values and instilling the faith and, you know, the principles of Islam in the children more so than with the first.
What would you say is like the hardest part of parenting?
I would say, you know, the love pangs. The love pangs, that's what I call them. But the love pangs are watching your children bump their heads, you know, and trying, you know, I had to learn over the years that you can't always stop it. You can't always protect them from bumping their heads. You just got to be there for them when they do bang their head up, and whether it's a little tiny bruise or a big gaping gash. You know, you have to be able to, you know, stand back sometimes. So I think that's been the hardest, whether it's young or, you know, whether when you are young going through stuff or as adults. It's hard for the mommy strings to be tugged at and you're not able to do anything.
And you mean that, like, obviously, like, physically, but also, like, metaphorically?
Oh, yeah, that was all metaphorically, not physically. I could deal with the physical, you know. It's either a Band-Aid, clean it up in a Band-Aid, or a trip to the emergency room, whatever, which I had plenty with all of you. Trips to the emergency room.
This right here. Yeah. I remember that one.
Yes, I remember that. And, yeah, that was all metaphorically.
Got it. Okay. All right. So now that you're in, well, let me back up a little bit. Did you ever feel like you struggled with like postpartum depression or postpartum anxiety?
No, I can't honestly say that I did. I know I went through some
baby blues
after the loss, you know. But I can't honestly say that I recall any postpartum depression after any of the births.
And for clarity, so the loss, there was technically two. There was like a stillborn baby and then a ectopic pregnancy, right?
Right. But the ectopic, you know, with ectopic pregnancy, it never really grows to anything.
But what was that like for you? Because I think you talked about the first loss and then...
Yeah, the ectopic pregnancy was not anything emotionally damaging to me because, first of all, I was not supposed to be pregnant, you know. We tried to make sure of that after the birth of the twins. So to have an ectopic pregnancy after that, it was like, what is going on?
But so I don't think I ever asked this. You went through a procedure to not have children anymore.
Right, after the twins.
And that procedure failed.
Yes, miserably.
Oh, God. But so that was painful, though.
That was painful.
Was that more painful than anything else? Like,
what I can, if I had to
equate it to something,
it would be the kidney stones.
Ooh.
That's what it felt like something big inside of a tiny little itty bitty hole. You know, and it was painful, and pain just grew more and more in intensity, until there was a rupture, and that's when I had relief from the pain. But you know, of course, that's no good.
Because you could bleed out from that.
Right. So that's when I went to the hospital.
So what do they do at that point? They just stop the bleeding and...
No, let me see. Well, it was now the fallopian tube was ruptured, so it had to be removed.
Oh God. So all of this doom and gloom. What is the good part about? I mean, you know, obviously I could say for myself, but for you, right? Like, you went through a lot. You had, you know, my oldest brother very young. You were a single mom. You've worked multiple jobs. You've suffered loss. You had twins, which I think is just insane in and of itself to have twins. What
many have twins?
I know, that's crazy.
And, you know, and our sister had 2 sets of twins. One of our sisters.
Oh yes, I was like,
crazy.
Yeah, insane. That to me is insane. Because I'm struggling with 1 baby, so to have 2 at the same time is insane to me. But what were some of the highlights of maybe pregnancy or mommyhood?
It was wonderful. I mean, when you were born, first of all, you were just a breath of fresh air from boys. I was definitely a boy mom. It was just, you know, I even learned to cut hair. I cut their hair, you know, and then you came along and that was a whole shift. So now I was learning to, you know, do styles when you finally grew hair.
I did that
first. It was very bald for a long time. You know, so that was a shift, and then it was wonderful, the little personalities, and, you know, you saw the home videos, the joy you all brought. Now, but the twins were unexpected. They were only a year later, and so it was 3 of you running around, and yes, it was challenging, but it was joyful because all of you were funny and had your own personalities, and I, you know, thank Allah that I did not have to be at work full time, because then I think it would have been something different. But you know, it was fun. It was fun, and we tried to center everything around our faith and family.
Mm-hmm.
Because it shouldn't be in your mouth. Don't put it in your mouth.
Now, I'm going to go back a little bit because growing up, you didn't always have your mom around, but you had your grandma, right? What has that journey been like? Because there's a phrase now of like the mother wounds, like people who might have not the best relationship with their moms. And not that you necessarily had that, but what was that like raising children or was she around by that point?
Yeah, she was around.
Oh, okay. Never mind.
Well, she, it's not that she wasn't, it's difficult to explain and a little, it's not complicated, but I just remember my formative years with my grandmother. That's what I could say. And, but I still remember her being somewhere, and even there, for a little while too. But still, as the children came, she was there.
So, but did that impact, like not having her around for your formative years, did that impact or influence the way you made up in your mind how you were going to parent in the near future?
Yes, definitely.
In what way?
I just remember what I remember most, and I can't say how that formulated what I wanted to do as a parent, but I do remember that when why are you so talkative today? During this time.
Come on, you sleepy. You said you do remember.
I remember. I remember just wanting to do so much for my first child. I remember I just had all these things in my mind about what I was going to do to make sure that I always had that thought. I didn't have this, but he'll have that, or this happened, but it won't happen to him. Just, yes, all of that made me want certain specific things for him.
What was it like to see me give birth to this one here?
It was amazing. It was amazing. You can't even explain that feeling. First, I think I went through some disbelief for a minute. Like, my baby is a mom. It just seemed like yesterday you were running around with your doll baby, trying to do her hair. I'm trying to do she hair.
Yes, I couldn't speak proper English.
You're a baby. I'm trying to do she hair. So, I remember thinking that, like, wow. And then seeing her and it was just absolutely okay, mama. The white.
Goofy. You said it was absolutely.
It was absolutely amazing to be there with you as you gave birth. Just help you through that, encourage you, and egg you on, push you on to to push and it was all amazing. It's all right, mama.
The tears.
Yes, she is. Yes, that was amazing.
And you thought that I might have to have a C-section too because I labored for so long too.
But no, I just kept pushing. Even though the thought kept creeping up, I kept pushing it out of my mind. Like, she's gonna do this. She's gonna do this. And praise be to Allah, you were able to.
And what I didn't know was that my mom, also had C-sections.
Yes.
I didn't know that until recently.
Right. But back then they didn't do the bikini cut. It was straight up and down.
So what does that mean though? Like, what's the
with the bikini cut, then there's a possibility to have a vaginal birth after the cesarean. But with that, when they split you up and down, you can't attempt a vaginal birth because it's a possibility the womb will reopen.
So, what are your thoughts on, like, now there's a huge advocacy and conversations around, like, Black maternal and infant mortality and loss and things like that. Because I was just talking to someone the other day, and we're like, okay, back in the day, right, your mom is one of, what, 14? 12. One of 12. Her mom was one of...
I think 9?
9.
No, not 9. I'm sorry. She only had 5 siblings. I think 4 or 5 siblings.
But back then, women had like 10 to 15 children and were, from my understanding, fine. Not to say that loss didn't happen, but it seems that there's been an increase in Black women dying. Why do you think that is?
I really don't know, except that, with me reading what I've read about it, except that the attitudes of health professionals when they come into, hospitals, back then, giving birth at home was nothing, and you had everybody around you, and you had experienced mothers who gave birth, they were there, midwives, so I'm sure there probably was loss too, but still, and but you also have to think about the fact that I don't know how big this was, but Black women began to die younger too. When you look at the in I would say 40s and 50s, they were dying in their 50s and 60s. That's pretty relatively young. But mama. But still, I can only attribute that to, the attitude of the healthcare professionals when a Black mother says that something's wrong, or this hurts, or and that happened to me on the operating table.
Please share that story.
Operating table. Yes, something happened where I could not breathe, and I could not breathe for a minute. Where I felt like I'm nearing losing consciousness. Something was stuck in my throat. Now, when you have a cesarean, they strap your arms down. I don't know if they still do it.
I don't think they do that anymore. Why would they strap you down?
So you can't move? I don't know. My arms were strapped down.
I gotta ask somebody who had a C-section recently, but I don't think they do that.
Now, this was with you.
No wonder this girl gave me so much.
No. This was with Radal.
Oh.
Yeah, because this was doctor.
Don't say that.
Yeah, this was that doctor. But let me think. No. This was with the twins.
Oh my God, you just went through all your children.
I know, no.
Okay, the point was you got strapped down. You couldn't breathe.
This was the twins. You know why? Because she... that my date to have the cesarean was on October 7th. And she said, no, I'll never forget this. This is why I know it was the twins. She said, no, I'm playing golf that day. So it'll have to be the 4th. And I just remember thinking in my mind, like, wow. But anyway, so I think it was the twins. Nonetheless, my arms were strapped down. And now I'm going back for, I don't know who it was. It could have Radel, the twins. And I couldn't breathe. Something was in my throat. And I can't remember if it was from the anesthesiologist. I had received an epidural. Whatever happened, I remember the health professionals around me saying, you're fine. You're fine. And I said, and I kept, I was gagging out with my last breath. I cannot breathe. Something, I was trying to tell them that something was right here and I couldn't get it down. So as they're still telling me this, and somebody saw the fright in my eyes, so whoever that was said to the other one, please try to calm her down. Tell her that she's fine, that everything's okay. So I'm laying there thinking, like, I'm about to lose consciousness. I have to do something. My arms are strapped. They don't believe me. So I literally called on God, and then I said, I have to get this out my throat somehow. And I just kept struggling with trying to either cough it up or swallow it. And I don't know which way it went, but somehow I was able to make it go down. And
I would be ready to fight everybody in there. But that was a similar situation with me where I couldn't breathe. I don't know if you were you there.
I remember I had left to come here.
Right. When that happened, I could not breathe. And I also had, it was after the anesthesiologist came.
Now, did they listen to you though? Did you?
Well, Raheem was there, so they had no choice but to listen. Yeah, the anesthesia. Raheem didn't play. The anesthesiologist had to run back in, and they had to, give me the breathing mask and that whole thing. But this isn't about me anyway. But that is so frustrating and upsetting. Even as I listen to you, just knowing that you're trying to express that you can't breathe, and God forbid something happened. Like,
yeah, I didn't have an epidural, so it had to be.
No, you had that. Didn't you have that? You had to have had anesthesia.
Yeah, but I think it was gas. I had gotten a mask over my face for the gas. with this anesthesia. It wasn't an epidural, I don't think. They were getting ready to perform the C-section.
Well, things were different back then. I don't know.
Yeah, because you can have an epidural or have whatever it is, the gas.
That's insane. That to me is still insane.
Yeah, I can't remember, but that's what happened.
Because it was 30 plus years ago. So
yeah, if it was Rodell, it was 30,
almost 40 years ago. Oh my goodness. Okay. All right. Well, frustrating things. But to that point, right, with all the Black maternal and infant mortality, I would say that you also feel this way. That's why it's so essential for us to have our own everything.
And then not only that, and I've seen this in my own family and in the community, especially when you don't have, you weren't brought up to place any type of value on your own health. So a lot of, especially our young mothers, don't even get prenatal care. Are very
possibly can't afford it,
right? Or very late going. I remember one young sister who didn't even get prenatal care. She got her first care when she started having problems. She was already almost 8 months. So I'm sure that is a factor too. Can't afford it. Healthcare is ridiculous. Even with the Affordable Care Act, it's still relatively high. Then if you're on Medicaid, I think that helped, because a lot of them will go to now you can get HMO and go to a wide array of doctors. Back then, I think it wasn't a lot of healthcare professionals that accepted Medicaid. I had Medicaid with my first son, and it was strictly the clinic, So she's almost asleep. So, lack of healthcare, lack of prenatal care, the attitudes of healthcare professionals, that's 3 strikes right there, and only God knows what else. Taking care of yourself. A lot of times we suffer with preeclampsia, that. And
I didn't have preeclampsia until I got to the hospital.
This is true. But developing problems before and during the pregnancy, if you're already obese, or already have diabetes, or already have high blood pressure. So all of those factors.
So as we kind of wrap this up to a close, I mean, you shared a lot, and I definitely appreciate you sharing your story. I mean, I kind of didn't give you a choice, but
you did.
No, but I'm grateful. What would be your lasting piece of advice? Because I think, for the most part, the people who I've come in contact with who have been watching Ummi Talks are either first-time moms, or they are women who want to have children. They haven't had children yet, but they want to be moms. And so they're getting this, I guess, information from moms and, people who've gone through the journey of motherhood. What advice do you have for them? You kind of already answered a little bit earlier, but any last piece of advice for the first-time moms who are out here struggling, and then the women who haven't become moms as of yet?
I don't know. I'm not the advice guru, but
you do have 40 plus years of motherhood under your belt, and grandmommyhood.
Yes. Again, I would say that it's all about you. So do the things that you need to do to make sure that you are okay. If that means reaching out, to family, to relatives, to a sisterhood, whatever case it may be, do that to make sure that you're okay. Because I was actually talking to a young sister today, and she said something that we hear often: you can't pour from an empty cup. So just make sure that you do everything for you. And I'm a firm believer. Once I heard Mother Tynetta say this once. Actually, it was in a magazine article. A magazine that was out back in the day. It kind of was like Yesteryear's Virtue magazine. I can't remember the title, but she was being interviewed, and she said, she was encouraging us as young women to.
You're shaking this.
Am I?
Yeah.
Oh my goodness. To go as far as our God-given talents will take us, to do everything that we want to do. But how did she put it? It was something to the effect that once you start your family, though, make that, you know, your full-time work. She said, no, she said, go as far as your God-given talents will take you. Do everything you want to do. She said, but raise your children first. That's what she said. So if you can, you know, if you do all that you want to do, if you, you know, have your sights set on becoming a nurse practitioner or a doctor, do that, and you know, go far in your career as you want to, and then plan your family. You know, one of the things that was taken from us was the science of mating. You know, because family is something that, when planned, you know, yields to me the best benefits. So, and the minister talks about it a lot in his How to Give Birth to a God series. You know, even in some of our reading that we've had, he talks about our hit or misses. But that's what I would say, because when you can just focus on that, and you don't get lost in that, then and to me, you won't get lost in motherhood, because it'll be something you planned for, and you know, were anticipated, and so that when it comes, you can enjoy it. You're not thinking about, oh, I didn't finish this, I didn't get to do this, I didn't do that, and now I'm in these, because that's real. I'm in these four walls all day with just this baby who needs me constantly. That is very real. That can get overwhelming. But and then to start thinking about all of what you didn't do, because you start getting lost in, you know, in not being you, or kind of like losing yourself, in so many words. So that's what I think. But you know, there are those who say, no, I can
do it all.
I can do it all. You know, and I'm. This is just me. I'm not a believer in that. I think you can do it all, but definitely one thing suffers more than the other.
And that's something that you've definitely always told me, that like it's like juggling, or that's not the language you use. You were saying something to the point of like something gets sacrificed along the way, and it's hopefully, I think the advice is, don't let it be you, because you are, you know, like you said, take care of you first. But something tends to suffer when we try to put everything on our plate at once. But I think
we don't even do that when we're not moms. So we definitely don't want to do it when we're moms.
But I think the other point is, like, you maybe can do it all, but just not all at the same time.
Absolutely.
I think that's what you've basically been trying to teach me, and I thank you for that advice, because I was crazy enough to think I was gonna do my PhD program when I gave birth to her, and that was a no-no. It wasn't happening, because something would have suffered, and so I appreciate you for being my mom. Anything else you want to share?
My daughter. Motherhood is just a lot. Isn't she just one? Isn't she a lot of work?
Yeah.
You're a lot of work, Mama.
A lot of work, Mama.
You're a lot of work, Mama. I get exhausted watching you two. So I know.
Yeah, you've been there. Again, you have me and the twins. Like, there's a gap between me and my older brother. So, you know, he was a little bit older, but between me and the twins, it was basically like having triplets.
Yeah, and you were their mother hen. Actually, you helped me a lot. I don't know how. You just grew up overnight once they were born. Became their second mom.
To this day.
To this day.
But, okay. Well, I definitely appreciate you, Mom. I'm not going to keep you. We did have to record this ahead of time because Mommy is a busy mommy and she got things to do. But I appreciate you coming on and just being transparent with whoever might be watching or listening. And thank you all for taking the time to watch this as well. So again, this is Ummi Talks. Hopefully we'll be back next month to do part 2 with our sister Halima. Again, this is the show, or not a show, it's a conversation where we discuss all things pregnancy, postpartum, and parenthood. until next time.
Well, I want to say thank you
Oh,
for being flexible to pre-record this. But, for this platform, I'm so proud of you. And I pray that it helps mommies wherever they may be. It's a wonderful thing, this social media and being able to do this and help each other. I just think is wonderful. So I wanted to say that.
Thank you.
Sign off.
But it came about from a conversation with you and I where I was just like, Ma, why didn't you tell me? And you were like, well, Nafisa, what did you think? Like, did you just think this was easy? And I'm like, no. I mean, granted, you made it look easy, but I don't think it was something, or maybe it was. I just can't remember. But it hits different when you're in it. Either way, whether you had the discussion or not, it hits different when you're in it. And
because I remember saying to you, but Nafisa, I did tell you.
Right. And I'm like, nah, but you didn't tell me to. But also, there's no way to predict what you'll go through. Some moms have very easy pregnancies. I had a very challenging pregnancy. So it was really, really hard. But out of that conversation with you and talking to other moms, I figured, okay, if we could give them the heads up that it's not this, well, let's start with pregnancy, right? It's not this fantasy, magical, again, for some people it is, but it's not always this romanticized, glorified experience, right? I mean, yes, I took my maternity pictures and it looked cute and all that, but it didn't feel that way. That was something that I did for myself to celebrate, the journey into motherhood, but it was very much a struggle. And so, again, this platform came about to try our best to educate people really before they become moms on all of the possibilities: the C-section, the vaginal birth, the VBAC. Hopefully one day I intend to interview Raheem. He's not ready yet, on his experience as a father, watching me go through everything that I went through. So the idea is really to educate moms before they become moms, but also help moms who might be in the thick of it and may not have that support or that mommy friend or sisterhood to go to ask them directly. Hopefully my hopes is that this will be that for them. So
it's awesome. I think it's wonderful. And, the way you all, because it's a support system for one another. Mm-hmm. It's wonderful. So
praise be to God. All right, everyone. That's it. Mama's asleep now. So again, until next time.